Well, hello and welcome to today's virtual panel discussion, Securing Healthcare's Interoperability Ecosystem. I'm Carol Flagg of Answers Media Network. Thanks for taking time to join us today. On this event, three industry leaders will discuss the critical issues vital to protecting health information as the industry gets ever closer to widespread interoperability. Today's discussion is being recorded and will be delivered back post-event. Also, we will allow time for some questions from the audience. The panel discussion will be led by Lee Barrett, CEO and Executive Director of the Electronic Healthcare Network Accreditation Commission, or EHNAC, a federally recognized standards development organization designed to improve transactional quality, operational efficiency, and data security in healthcare. He served in this capacity since the Commission's inception in 1995. Lee works on key initiatives that lay the foundation for health information technology, including support and implementation of important healthcare legislative mandates. He was appointed by Dr. Donald Rucker, National Coordinator of the ONC, as the FAST co-lead of the Testing and Certification Tiger Team, and is a member of the Executive Committee. Lee also currently serves as a member of the HHS 504D Cybersecurity Information Sharing Act, the Healthcare Sector Cybersecurity Council, the EHI Leadership Council, and co-chairs the Sequoia Interoperability Matters Leadership Council. Joining Lee is Michael Parisi, Vice President of Adoption at HITRUST. Michael has led over 500 controls-related engagements, primarily in the healthcare and financial services industry, and has extensive experience with third-party assurance reporting, including HITRUST readiness, HITRUST certification, SOC 1, SOC 2, SOC 3, agreed-upon procedure, and customized AT 101 engagements. He also has several years' experience implementing large Oracle ERP systems, specializing in the general ledger and governance risk and compliance modules. He has extensive knowledge of financial reporting and regulatory standards through his external audit and consulting experience, including Sarbanes-Oxley, HIPAA, NIST, CMS, and state-specific standards. Rounding out the panel is Dr. Tim Pletcher, Executive Director of the Michigan Health Information Network Shared Services, a public and private nonprofit collaboration dedicated to improving the healthcare experience, improving quality, and decreasing costs for Michigan's people by making valuable data available at the point of care through statewide health information sharing. Dr. Pletcher is also an adjunct research investigator of learning health sciences at the University of Michigan Medical School. Previously was the founding director for the Institute for Health and Business Insight at Central Michigan University that provided high-end data sciences services to Fortune 500 companies and large organizations to extract insight and value from their data using business intelligence and predictive modeling. All right, and now I'm going to turn this discussion over to Lee Barrett so you can get the ball rolling.
Thank you, Carol, and welcome everybody. Great to have you here with us for this webinar. I think you're going to find we've got some great perspectives that both Mike Parisi and Tim Pletcher and myself will be talking about, and we're really looking forward to as well in the Q&A portion to get your some of your thoughts as well and questions around what we think are very important topics in healthcare today. And this first one is a very important one, and we've seen a lot of change in the whole telehealth side of this, especially with the pandemic. And as we've seen kind of the explosion here of really the use of telehealth services, jumping from 25% in 2018 to 80% in 2020, which was by the AMA's latest physician benchmark survey. So what we're going to talk about here is some of the unique security, challenges this trend in telehealth has really created for physicians today, especially around, as we're looking at the patients and being able to provide this capability to patients. It is an interesting one. I have talked to some other entities in really the provider community who have said that although during the pandemic it was this high, and as we all know, nobody was wanting to go to physicians or anywhere else, so they were all doing everything was telehealth. What's happened now is that we're seeing kind of more of a balance that's occurring. Certainly telehealth is still there at a very high percentage, but we're seeing a lot more organizations as well in individuals wanting to go to see their physician in person. So there's more of a balance that's occurred here. I think the 80% mark is probably less than that now, but I think we're, certainly telehealth is here to stay, and we're going to see a lot more and a lot more kind of that balance between patients wanting to actually go see their physician in person versus the use of telehealth. Before I kind of ask both Tim and Mike to give their perspectives, let me give you a couple of kind of data points from what I'm thinking about here. So I saw that there was a federal update that the Office for Civil Rights issued some telehealth guidance just recently. And what they indicated is that when the pandemic occurred, a number of issues that they put in on being able to provide greater freedom and less oversight of telehealth, not only the providers, but also the vendors, they put in place to allow for more and less opportunity for issues that would occur from a security perspective with providers, especially around HIPAA in particular. What has happened now, and certainly as we're coming out of the surge on the pandemic side, this notification came out that said that from OCR that the notification of enforcement discretion for telehealth is no longer in effect. So they've taken that off, and so now there's going to be greater scrutiny in relation from an OCR perspective anyway, around how physicians and telehealth vendors provide and are assuring privacy and security around this. Less so than the controls or less controls than they had certainly as well during the pandemic. If you start to look at this, and I started looking at some of the key things that I think providers need to be thinking about and have in place, especially around privacy and security and to prevent a breach. The first is really kind of the use of multi-factor authentication or single sign-on is one that we think, again, adds additional layers of security here. Second is to assure that providers are looking at their third-party contracts to assure that whether it's the telehealth vendor or others that they're working with that are providing the services have the appropriate privacy and security in place. So that's a second. The third is the whole aspect around training within the provider office to assure and to train employees within the practice on really privacy, security, obviously the HIPAA requirements around the privacy rule and the security rule as well. But again, kind of raising the bar within the office as well. And lastly, is really providing some type of layered security in order to meet HIPAA compliance. We think that, this goes back to kind of the encryption capabilities, especially as we're looking at these capabilities between patients and the providers and having the ability, obviously, to have these telehealth sessions. The last thing I'm going to mention is the provider needs to assure that the patient is really using what I would call a non-public facing remote communication product. So some of those basically are like Apple FaceTime, Facebook Messenger video chat, Google Hangouts, WhatsApp video chat, or Skype. Products can include texting applications such as Signal, Jabber, or Facebook Messenger. Zoom would obviously fall into that as well. But basically platforms that are employing end-to-end encryption. Products like TikTok, Facebook Live, Twitch, or a chat room like Slack are not acceptable forms of remote communication for telehealth. So some additional things that at least I think providers need to be thinking about as they're looking at their security environment. So that's kind of my thoughts on this before I turn this over to Mike. What are your thoughts on kind of some of the issues that I think the providers should be looking at here in relation to their unique security challenge?
Yeah, I think you nailed it, Lee. I think that the third-party contracts and making sure that they're obtaining the appropriate assurances is absolutely key as part of the equation. I think what most organizations do today is they don't know what they don't know, right? Relative to those types of relationships. So they may think that they're checking the box through the procurement function, through some type of proprietary questionnaire, et cetera, but that's not really giving them the appropriate level of transparency into what these organizations are doing relative to the maturity of their programs. So I think it's not only ensuring you've got the appropriate contractual obligations and requirements, but it's also making sure that what you're asking for is the appropriate level of assurance from those organizations or from those vendors or third parties, right? To give you the right level of transparency into what risk, whether it's inherent risk associated with that relationship or the residual risk that you're left with from an organizational standpoint. And I think, most companies, again, don't know what they don't know. They may be accepting a certain level of assurance, like a SOC 2, for example, kind of blindly, without recognizing the limitations around those assurance mechanisms.
Good.
I don't know, Tim, anything to add there?
Well, I think one of the things that we don't talk about is the end user side, and that a lot of this virtual care and telehealth. I mean, patients in every satisfaction, to go back to the 70s, have loved telehealth. Okay, it's always been a systemic issue with the healthcare system not being able to sort of do it. When we took off all the controls and all the excuses and we actually let the money flow, patients got what they wanted and they love it. And now with the unwinding, where we're going back and saying, whoa, okay, wait a minute. I think there will be a little bit of backlash for folks who got pretty comfortable with some of that. But I think there's a very appropriate tightening up of those controls now, okay, because we're out of crisis mode and we're into it becoming a kind of a way of life. But I think that we can't underestimate the magnitude of, people know how to use Zoom. They know how to use FaceTime. Okay, so we didn't have to train thousands of people across the country to do that. As we go to more rigid solutions, multi-factor authentication, people are sort of coming on board with that relative to their bank account. But, I think we can't underestimate that some of those extra controls when you're trying to schedule a visit remotely for patients is it's harder than just going down the checklist. And there's some human factor pieces where we can't ignore education of the patient base and explaining to the patients why we're doing what we're doing. Because I think a lot of times we say provider training, but in reality, the patients need to know why we're protecting them by putting some of these quote barriers in between them and the system they want to get access to. And not everybody's good at it. There were a lot of pictures of people they said, show me something on your body, and they got a picture of the cat standing next to them. I mean, so we just got to be sensitive to that aspect, but recognize that we need these controls now, because it is becoming a critical component of the infrastructure. It's not the bolt-on that it was at the beginning, and therefore driving to some standards of behavior, making sure those contracts with your vendors, a lot of those vendors were fly by night, and now they're part of the ecosystem. They're startups that had a big opportunity. We need to make sure that they understand their HITRUST accreditation, et cetera, right? And that they have one. So yeah, but I do think paying attention to educating the users about the need for those controls and that providers are actually holding that standard up is every bit as important as the providers themselves getting educated on what they can and can't do. So
I think it's good. I think the other thing that, that I was reading in doing some of the research on some of this to look at kind of the current data is the whole aspect that many patients today are also using, the Internet of Things. They have a lot of different technologies in their homes. So the other aspect about all of that today and the various devices that people have, whether they're implantable or they're not, or they're an Amazon Echo or whatever, the issue is all of this sensitive data as well. People need to be aware of with the Internet of Things is also another factor. That from a patient perspective, going back to your point, Tim, that it is, although not quote directly linked with telehealth, although there's some linkage there. The issue is all about people need to be thinking about and aware as well of the privacy of their own within their own environments of the data and the sensitivity of data and all of those issues around what is being made available, et cetera, to other entities who may be taking and using that data, right? So those are all, I think, additional issues that are from the privacy side of the specter is there. Mike, I know you see some of that as well. You've seen that on that kind of the IoT side of it, and I don't know if you'd agree with that as well. But that's just another big factor that's out there for the patient side of this equation.
Yeah. So actually, Tim and I were talking about this yesterday. When you think about IoT and medical devices, and as remedial as it may sound, I think the biggest issue that organizations have, especially health systems, right, and hospital systems, is inventorying it. Like, how do you know what your asset inventory is? I mean, there's so many of these devices that are coming in and out of our environments constantly. And having an accurate inventory is challenge number one, right? If we have a complete and accurate inventory, then we can at least do some level of analysis around, are there vulnerabilities associated with those devices? As we know, with medical device manufacturers and with the limitation from an FDA requirement perspective, they kind of put their hands up in the air and say, not us, right? We're going to give you a level of guidance as it relates to configuration once you install it within your environment. But it's on the health systems and the hospital systems to install it and configure it appropriately. When we're talking about care delivery, I don't know that that's necessarily the first thing that they're thinking about, as opposed to, we got to get the appropriate device so we can deliver care, right? So there's a lot of challenges associated with that. I think one of the biggest issues is the organizations or even the institutions that are trying to set policy don't even understand what are all the vulnerabilities and issues associated with that. So it's one thing to say, you must protect IoT, you must protect medical devices, but they don't necessarily understand the configurations. They don't understand when full HL7 files are sent over to a medical device, when really they only need 2 out of the 21 elements, right, that are associated with that file. And they don't necessarily understand even patching associated with the operating systems that those devices may have. And so I think it starts with having an accurate inventory and making sure there's appropriate diligence, again, from a transparency perspective, as it relates to the security and privacy configurations. I don't know, Tim, any thoughts on that?
Yeah, I think there's this ever expanding attack surface, right, for folks, and all the security people are trying to squish that attack surface down. But when you get to, remote monitoring of patients at home, when you get to virtual care of, quick little texts and sending out announcements, it starts to build a much wider footprint than I think you expect. And so getting an inventory on that, getting a mechanism to, at least if you can't do an inventory, stage gates for, okay, I've got a vendor that actually gateways all my remote monitoring stuff. I mean, putting these sort of guardrails in place is actually better than not having a strategy for how you're going to deal with that on a wide basis. And I think I think people underestimate how big the Internet of Things are and how tempting it's going to be to just meet patients where they're at. And some of those patients are surrounded with no locks on any of their Wi-Fi systems. All of their, devices are open, no software, on any of their devices to sort of prevent viruses and things. Okay. And, you are trying to reach them on their device with your system. You need to be able to trust the vendors that you go to for that, to have some measure of rigor before you let them bring those people in your door.
Add to that what both of you are talking about, the environment where somebody hasn't set a policy on giving specific devices, but says you can bring your own device, right, and use your own device within that environment, where they're not controlling what that individual has as far as patches that they're doing or how that's being used, how it's secured. And then now you got protected health information that they may have an access to an EHR through that. I mean, it just, yes, that goes back to kind of that whole inventory, Mike, right, of knowing what you have and then managing to what you have and looking at your policies to determine whether or not you need to change your policies in an effort to reduce that whole risk vector that you're dealing with, right, with all of the employees that you have. So very interesting topic. And we got into medical devices, telehealth. We talked about the whole Internet of Things. Some really, I think, great topical areas. Carol, can we go to the next topic, please? So the next question we're going to talk about, next topical area, really focuses on cybersecurity breaches in healthcare, hitting an all-time record, where we're looking at kind of exposing protected health information for 45 million individuals, according to HHS, because of the cybersecurity breaches. What are some of the steps that healthcare stakeholders and business associates should take to mitigate some of that exposure in this climate? So let me start here, Mike. Let me turn it over to you. I know that HITRUST has, looked at this. You've got a great framework, trust framework that you put in place. Why don't you talk about this from kind of the cyber kind of trust framework that you've implemented at HITRUST across the ecosystem here?
Yeah. So I think, and Tim alluded to this a little bit, and Lee, you did in the kickoff. It's about control rationalization is what I would say, right? So for years, we've kind of gone through this checkbox exercise of making sure that we've got an appropriate security and an appropriate privacy program in place, and are we meeting the regulatory requirements, certainly HIPAA, some others, maybe CMS, et cetera, and now some of the new requirements like TEFCA, ONC. But as we know, compliance doesn't equal security and privacy, right? And I think what we are seeing is we're seeing a shift within the marketplace that says all that stuff is important. We want to make sure that organizations have appropriate security and privacy programs in place. We want to make sure they're following an industry recognized standard or framework. But if we think about triaging, the very first thing that we want to understand is, what are the cyber vulnerabilities, right? Because everything that we read about and everything that we see in today's day and age, it's really focused on three things. It's MFA, it's phishing, and it's ransomware. right? 95% of all the adverse events that happen are related to those. So in our research and in my personal conversations and talking to a lot of CISOs and chief privacy officers, they're saying it's not that it isn't important to obtain appropriate assurances from our business partners, like a HITRUST certification, like EHNAC accreditation, right, and a series of others. But first and foremost, I want to understand, are these organizations being adaptive to cyber threats? And how do I get assurances around that? And really the only answer is to rationalize what controls and what elements of programs are appropriate to address those risks and to make sure that they are adaptive and updated over a period of time. So that's really the shift that we're seeing away from these proprietary information security questionnaires, et cetera, to say, look, what are you doing around these top cyber threats? What do you have in place? How do I get assurances that you have that addressed? So it is a shift that we've seen over the last 6 months to a year, and I think we'll continue to see that shift. Tim, I don't know, anything to add? Any thoughts there?
You know, I think we talked about Internet of Things before, but most of those cyber attacks were coming from, if you believe some of the reports on it, were coming from sort of networks, and they were not being launched for small, tiny devices. They were being launched from big, powerful servers and that folks had sort of, you know, broken into. And there were an awful lot of denial of service kinds of attacks and HTTPS, and those are a little bit harder. We haven't seen as much of that in the past. And so I think, you know, I think what folks need to be prepared for is this is an escalating space. People are getting better and better at this, and they're building more and more tools to help them do the attacks. And so finding and automating the responses and actually finding people to help understand how to do this is increasingly hard. And you know, one of the participants in this webinar kind of said, well, we got staff shortages, we've got all kinds of stuff going on. And that's absolutely true in the cybersecurity space as well. It's really hard to keep good people. It's actually really hard to keep anybody in this space now. And so I think finding solutions that are automated and rationalizing, as Mike said, you know, it's hard. I really don't know what small independent, you know, physician groups can do on their own. You know, this is a hard space. Bigger systems are struggling. I don't know what smaller systems and individuals can really do here. Yeah, this is a tough one.
So I would tell, so this is good conversation. There's a few things I would probably add to this. First of all, for smaller providers, the 405D Cybersecurity Information Sharing Act, CISA 405D, which is part of Health and Human Services, has really developed some really great resource materials for small practices on what they need to do, what they can do, without being overly burdensome. So I would say anybody that's out there, please, you know, you go to the 405D CISA website on Health and Human Services. There are some great resources out there. The other aspect that they've tackled is around larger entities, like the enterprise level organizations that have large infrastructures, et cetera. Again, providing some really great guidance around what organizations can do around their, quote, cyber hygiene. And really, that's what organizations as well should be looking at. There's some great resource tools. I think somebody else was talking about on the chat here, OCR really has some great information as well around privacy, security that people should be looking at, and some great tools there. I would just add to kind of Mike, your point as people are looking at, okay, specific takeaways that you can be looking at within your organizations. And Mike, you talked about multi-factor authentication, absolutely critical. I agree. I think the whole aspect around training, especially within organizations around phishing, et cetera, are important. Penetration testing, doing an annual risk assessment, doing the inventory, asset inventory is also important to know what organizations have. Also, making sure and assuring that you're applying patches to all of your software on a regular basis as needed. That's also another specific quote vulnerability that people have by not doing those patches. We've seen a number of these ransomware attacks in which people just did not apply patches when they should have, and have created a vulnerability for these ransomware attacks to be planted. Absolutely critical. The other, and lastly, is the whole aspect around, and I know Mike, you'll like this too, because it's a very important part of not only what you do as far as HITRUST, what EHNAC is doing, is around third-party risk management in managing your third parties that are performing services on your behalf to assure that they have the appropriate hygiene and kind of risk rigor that you're hopefully managing internally, and therefore not taking on more risk within your organization. So those are some of the, as we're looking at the kind of the cybersecurity breaches, those are some of the hygiene things that I think all of you can be thinking about within your organizations. Any other thoughts, Tim?
Yeah, I wonder, do you know of any programs at all for like FQHCs or for Medicaid providers at all that sort of actually give them assistance? Because while I agree there's lots of material, there isn't a lot of time to read it and do your day job for some of these folks. Is there anything that either of you are aware of? Because I'm not aware of any actual programs of actual help.
I can tell you the best that I've seen, Tim, quite frankly, and I've been involved with developing a lot of these resources on the 405D.
Mm-hmm.
Those are really great documents. They're easy reads. They're easy for an organization to go through. And one of the things that I think that you're talking about, which is important, in many cases, a lot of these smaller entities do not have a dedicated IT resource or chief information security officer to oversee, or privacy officer to oversee. In many cases, for a smaller entity, it may be an administrator that's been given that role.
Right.
So the documents that they put together here are really easy. They really create kind of the walkthrough of what organizations can do to build from a very small, start small, build upon it. So I think that's what you're asking about. Those resources are good, and I will on the presentation at the end of it, I'll put that resource on there so that people can have it to go out to, because I think it's a really good resource.
I think that'd be really helpful because that's a tough spot to be in.
Absolutely, good point. Mike, anything else you would add?
Yeah, so it's a good question, Tim, and I want to comment on two things. So one, your comment was a lot of these organizations or care providers, especially your smaller, right, physician practices, they don't know where to start. I couldn't agree more. That's not their core competency for a reason, right? I mean, they're in the business of delivering care. That's what we want them to be doing. So I think we need to do a better job. When I say we, I mean us, right, as a community, in defining what's most important, because the regulators certainly aren't going to do it. They're not going to make it easier for some of these smaller practices to understand what the risks are. So I think it goes back to, what is the rationalization around the program, even if it's the bare minimum. I mean, Lee's talking about some references that I think are certainly great references, but I mean, if you look at even just the HIPAA security rule, if you look at some of the safeguards and the requirements, if you look at the Department of Labor, I mean, there's so many different resources that are out there that organizations can leverage, and it's all about having the appropriate cybersecurity hygiene that's in place at a minimum, right? That's one of the things that we've strived to do in partnership with EHNAC. I mean, Lee and I talk pretty much every week, right, to say, hey, what are the appropriate things that organizations should be addressing? And those are a number of things that we've incorporated within our resources and frameworks for organizations to leverage to address that risk. What's most interesting, though, associated with this, and I think we're going to pivot to it, there was somebody that commented on this in the chat, is the cybersecurity insurance, right? So what are the underwriters looking at, or more importantly, what are they not looking at that they should be looking at and considering? I can get on my soapbox with this for hours, so I'll keep it to a minimum. But you know, last I looked, cybersecurity insurance premiums certainly aren't decreasing; they're only increasing. Exactly. And, you know, the question in today's day and age is not how do we decrease our premiums, it's how do we minimize the increase that we know we're going to get, right? Most organizations are seeing 300 to 400%, literally, on a year-over-year basis. And not to mention that the limitations associated with those policies are decreasing. So how do we get more favorable terms relative to cybersecurity insurance? And part of the problem is with most insurance that we're all familiar with, whether it's health related, whether it's, you know, P&C or specialty lines, auto, home, et cetera, it's all about experience rated data, right? So we have hundreds of years of experience rated data associated with claims. I mean, this has become such a science for these underwriters and carriers to say, well, we know exactly what the potential risk is. If a 16-year-old male is driving a red Corvette in Los Angeles, we can calculate the risk associated with that, right? I think on the cyber side, unfortunately, there's now more experience rated data, but the carriers and the underwriters don't understand what are the limitations associated with their current model. And as a result, they may be asking questions that we know are relevant. MFA, what are you doing around phishing? What are you doing around ransomware? But they're not looking at this concept of organizations providing assurances over the maturity of their security program. So I think it's really, really important that we continue to educate that community, which we're doing almost on a daily basis. Lee and I have got some joint efforts that we're doing with a number of different carriers and underwriters to say, guys, you need to understand, you know, the days of executing a questionnaire and applying the same approach that you would apply for P&C, auto, or home doesn't come into play when we're talking about cyber, right? There's different things. You need to understand if organizations have made investments within their security and privacy program, that ultimately is going to reduce your risk.
You know,
So
I think
just some thoughts.
You know, Mike, I do think that whole issue on bringing in kind of the cyber insurance is an important one here for the audience. I'm seeing with some of these entities, I think, as you were talking about, that some of the carriers are getting to the point because the payouts are becoming so high for them. That they are really, some of them, getting to the point where they're going to be requiring a third-party accreditation certification, such as HITRUST and EHNAC, before they're going to underwrite, because they're looking to mitigate some of their own risk, you know, before they're going to take it on. So I think there's going to be, and you're probably seeing that too, that there's going to be more, I think, carriers, just as you're saying that the premiums are going up. I think the underwriting scrutiny is getting much more refined, and they're becoming much stricter on their underwriting. And what they're covering is, as far as are actually, as far as the limits are actually going down, as far as what they're willing to pay out. So in a way for them to mitigate some of that, I think we're going to be seeing a lot more of these carriers, cyber carriers, putting in a requirement for a third party assessment before they're going to even be looking at it. Is that what you're seeing as well?
Yeah, I don't know how they don't, Lee, to your point. And when you look at, I want to get Tim's thoughts here in a minute. I call it getting ready for the fashion show, right? So a lot of the brokers, I mean, it's literally a fashion show. Like, that's how this happens in today's day and age. A lot of the big health systems, it's a presentation to 20 to 25 underwriters and carriers around the maturity of their program. And those carriers and underwriters are asking questions, and the broker, of course, tees this up. But it's like a fashion show, and you've got one shot, right, to make sure you look your best in front of all those organizations. And you're hoping that somebody actually offers you a policy. It should be the other way around. Organizations should be in a position to say, we've made investments in our security and privacy programs. This is why you want to underwrite us, because we have a lower level of risk as opposed to an organization that hasn't made those investments, right? So the model's broken in today's day and age. And I think the brokers are key to driving the appropriate message and educating the underwriters to say, you should require some level of assurance before you underwrite any type of policy associated with cybersecurity insurance. Tim, any thoughts?
Yeah, I write big checks every year for this, and they keep getting bigger. And we work hard with, both EHNAC and HITRUST accreditation kinds of things. And I'm not feeling those discounts yet. But one of the things that I think we're getting to the point on cost is that I'm expecting to see groups form that pool their cybersecurity resources and self-insure. Okay, because I think we've gotten to sort of the Wild West here, where one, it's like I said, it's hard to get these resources, but I think there will become, maybe it's happened and I just don't know about it, but I think it'll become a real market opportunity for a cybersecurity company to basically round up and start doing these sort of cybersecurity services for a bunch of clients and insure them. But they are the cybersecurity arm. They're sort of, protecting their own wallet, if they will, for being the self-insured kind of space. And the premiums have gotten that high, and I think I think there's enough of a market for those two things where if somebody came along and bundled those two together, it could turn out to be a really powerful combination.
Interesting. Yeah, good perspective as well. All right. Great topic, and we touched upon a number of areas here. So let's go to